Now in your exam, if you get a case of ankylosing spondylitis, then you are supposed to know the special test for SI joint. So SI joints lie here. So for that, you ask the patient to lie down supine like this. For the first test, which is known as the pump handle test, you take the patient's knee and you bend the knee and then direct this knee towards the opposite shoulder, and then you apply a pressure. If the patient complains of pain over the SI joint, then this is the SI joint stretch test, and that means the SI joint is involved. Now the next test is the Faber's test or the Patrick's test. For that, on the involved side, we lift up the patient's leg like this. We keep the ankle free and over the thigh. We have to make sure that the entire leg here is above the knee level. We stabilize the ASIS using one hand so that there is no rotation of the pelvis when we do this. And then with the other hand, we apply pressure over the knee joint in the downward direction. So I stabilize the ASIS like this, and then I push the leg down. So now this test can be positive in three ways. If there is any hip joint related pathology like arthritis or something else, then the patient will complain of pain here at the hip area. And also we might not be able to push the leg below the level of the other leg. That means this knee will remain above the level of other leg. Secondly, if the patient is having SI joint problem, then patient will complain of pain here at the SI joint region. Or third, if patient is having lumbar PIVD, especially of the lower nerves, especially say at L4-5 or L5 region, then when I'll do this by fixing the pelvis, patient might complain of pain going down the leg. Below the knee, if there is a radicular pain on doing this test, then it is positive for lumbar PIVD. Now the third test for SI joint is, we expose both the ASIS, we keep our thumb over it, and then we try to distract the pelvis. That is, I apply a force outwards. So I apply a opening up force on the pelvis. So because of this test, if patient complains of pain in the SI joint area, this is also a confirmative test. Similarly, if I try to compress the pelvis, this is known as pelvic compression test. If I try to do this and then also patient is complaining of pain in the SI joint area, then this is also a diagnostics test. Now the next test is Ganselin's test, for which you ask the patient to move to the edge of the table. Move out and hang this leg freely so that the pelvis is rotated here and fixed. Now the other leg you slowly flex like this and hold it firmly against the chest. So because of this, the SI joint is stretched here. So if the patient complains of pain during this maneuver, then this test is positive, and this is known as the Ganselin's test for SI joint.